Lanice Taylor, and I'm going to speak to you on the topic of diabetes and prediabetes, the effects, and how to prevent or delay the onset of diabetes. According to a report from the American Diabetes Association, 2014, June, in 2012 in the United States, there were 29.1 million people with diabetes. More than 3 times that number, 86 million, had prediabetes, a condition with elevated glucose levels not yet at the level of diabetes. People with prediabetes are at very high risk of developing diabetes, while those already diagnosed with diabetes commonly have a progressive loss of glucose control and increased blood glucose levels over time. In people with diabetes or prediabetes, the increased levels of blood sugar can damage blood vessels, the heart, kidneys, eyes, and nerves. Research suggests that people who are at risk for developing type 2 diabetes could increase their chances of preventing or delaying the onset of type 2 diabetes by changing their diets and exercising more. A preview of my main points. Diabetes is a major cause of disease and death in the United States. What are the risk factors for diabetes? Changing diets and reducing weight could significantly influence the chances of preventing or delaying diabetes in people who are at risk for developing diabetes. Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. Too much glucose or sugar in the bloodstream caused by people who eat is called hyperglycemia. Hyperglycemia can cause increased thirst, urination, blurred vision, fatigue, slow healing, infection, and nausea. These are also warning signs of diabetes. High glucose levels in the blood can cause severe life-threatening complications. Hyperglycemia over a long period of time can lead to serious complications such as blindness, kidney disease, nerve damage, amputations, heart attacks, and stroke. People with a family history of diabetes, overweight, high blood pressure, high cholesterol, gestational diabetes, and certain ethnic backgrounds are at higher risk. According to the American Diabetes Association, there are 1.4 million new cases of diabetes in America. Diet can influence type 2 diabetes and can prevent the disease from progressing. In this graph, developed by the Diabetes Prevention Group, New England Journal, 2002, the DPP study over a 3-year period from 1996 to 2001 showed a 58% reduction in weight in participants in the lifestyle arm compared to participants in the metformin, a first-line diabetes medication, which showed a 31% of reduction, and the placebo arm, which had no change. The DPP showed reducing weight through exercise could significantly or delay the onset of prediabetes or diabetes in people who are at high risk of developing diabetes. The lifestyle cohort in the DPP study went through a 16-session course over 24 weeks. They received education in diet, exercise, methods, and behavior modification skills. According to an article written by Farley T.A. and Dow D. 2014, physical activity has the greatest benefit in reducing levels of glucose in the blood. Almost all activity causes muscles to use stored glycogen as fuel. This study of sedentary insulin-resistant middle-aged adults who engaged in 30 minutes of moderate intensity walking 3 to 7 times per week for 6 months found that participants succeeded in reversing their insulin resistance without changing their diet or losing weight. Research suggests that people who are at high risk for developing type 2 diabetes could increase their chances of preventing or delaying the onset of diabetes by changing their diets and exercising more. Research showed that people who engaged in lifestyle changes, by exercising more and making healthier food choices, increase their chances of preventing or delaying the onset of type 2 diabetes by better glucose control and weight loss. Thank you very much.